Hello, it's Dr. Scottmaclean, and we'll be doing a NobelReplace 13mm, and this is to show the guided implant protocol. So you can do a dense protocol, which is a complete protocol, and you can see the number of drills that you go through, and we'll go through these in this exercise. Or you could also do a soft and medium bone, which is the typical use of this kit, and so you would not do the dense bone optional protocol. So we'll have a look at everything. We'll get the kit back from sterilization. You can see I've already opened the outside cover, and then I'm going to the internal. Everything's showing that this kit is sterile. And as we open this, we can get inside of it's called a Pure Set surgical kit. And it shows that the sterilization is being tracked and watched. And as we open this, then we can start to go through the kit just to help you to do your exercise that we're going to do. So the kit is really organized. It goes from left top corner to the right. So we're going to use some start drills, and we'll go back and go over these. And one of them is the twist drill. Then we'll go into the tapered drills. We always use an 8mm first, and then the optional drills, which are the dense bone drills, the screw tap, and the cortical drill. So we're going to go back and look at those. We will be using drill guides, so you can see the two yellow ones on this case. And then we'll use drill mounts, and these are to put the implant in at the end of the exercise. So let's get going, and we can give it a go. During this exercise, we're going to be placing a 13mm long by regular platform 4.3 NobelReplace. Let me introduce you to the protocol. We're going to start with the twist drill, which is a 2mm pointy drill with internal irrigation. Then we're going to go to a 3.5 by 8mm replace tapered drill. As we come across, we're going to go to then a 13mm long drill, which is the length, and it's by 3.5, which is a narrow platform. Then we'll come down to a 4.3 by 13mm drill, which is the final drill normally. Sometimes you'll have to go and do some more drilling because the osteotomy might be tight. So we use actually a dense bone drill or a screw tap or finally a cortical drill. We don't often use the optional drills unless the implant's not seating at the time you're placing the implant through the guide. The osteotomy is going to be created by using drill guides to guide the drills into the exact position that you've chosen on the DTX software. So patients often ask how you can get from the software to here. This is how we do it. So we would take the guide, place it in the patient's mouth, make sure it fits, and then use that ring to guide all the drills. And so this is the key to having excellence in implant dentistry, is to getting the implant exactly where you want it to go. So the model without the guide, it becomes difficult to place the implant if you don't have a guide. Yeah, you can do it, but when you're on the opposite side of the patient, it becomes a little bit more difficult. So looking at the drill, it has internal irrigation and external irrigation. And so it's got this Y valve, which splits the saline, so going up through the drill. So the first, we can look at this and we can see the water's going to travel through and then come up to the back and go right through the middle of the implant drill. So take time to look at the drills, and you can see how it's going to fit directly inside this and on top of this cannula. There's also an external water supply, and the external water supply comes out through the lateral aspect of the drill right here. And these two aspects keep the drill cool and also clean, because there's going to be a lot of bone that's starting to be collected. And you do have to clean inside the drills when you're doing your sterilization protocol. So here, looking at the end of the twist drill, you can see that there's a little hole, and so the cannula will fit inside and then keep that super clean and also cool. So because they do generate a lot of heat when you're doing drilling on all implant systems, they generate heat, and especially if you're in a guided situation, which is 10mm up higher. So we want to make sure that that stays cool. So this is a great system. You do have to make sure you clean the inside so you don't get bone. But here's one drill, the precision drill, that does not have the access hole. And then the second is a twist drill, and you can see that the cannula would fit inside of that and keep it cool. So the water actually comes right out the end of the drill itself. So we're going to start with a 2mm twist drill, and it does have a hole in the bottom of it. So we are going to insert the cannula into this. So it has the various lengths you can see here. We're going to be drilling to a 13mm length. So you have to know which line this is, because this is the only real depth area that we're going to be using. Everything else is the 13mm drill, but you have a choice here. So we have to go to that line marked 1, 2, 3, 4 up, and then so stay to that line. So looking at the drill, it's got a pointy tip, and it's nice and smooth, straight, and it's going to be cooled internally with the internal irrigation. So we'll start by applying this drill into the handpiece. So hard to do this in front of the camera, so I'm trying to have a look, but usually very easy to put it in. And so you slide it in, and you won't have the cannulas usually for the exercise, but you have to know that this is what you would use to keep the whole system cool. So we're going to use a drill guide, which is the first of the two yellow, and this fits into the ring. So this will fit into the ring, and then you know you're on target, because this is going to give you depth, angulation, and position of the final implant. So we are going to choose to go into the 13mm line, which is second from the top. And you can see that as we go in, we're going to, I sometimes will go a little deeper just in case, because sometimes I want to place the implant a little bit deeper. But we're going to drill to the implant length and then take this device out. And you can put it back in the kit. So then we'll go to the second guide, and the second guide is going to fit the tapered drills. And so we have 3 tapered drills we're going to use. We're going to use the 8, and then we're going to go to the 13s. So the 8 is always used in the NobelReplace system, and it's to get some of the bone removed and have the heat last when you're doing the final osteotomy. We'll have another look at the protocol. So this is the soft and medium bone protocol. So you'll notice that you're not getting into the optional drills on this protocol. So I've been just showing you the first part of this protocol, but we're going to take you through this and teach you how to do it. And on today's procedure, we're also going to do the dense bone protocol, which in this case probably wouldn't be needed because it's not really dense bone, but you just have to know this protocol as well. So let's start the dense bone protocol. We've done the 2mm drill. Now we're going to go to the tapered drills, which is the 8mm. We always start the protocol with that, so even on any length. And so the 8mm drill is the tapered drill, and then we start and go to the 13mm long drill, which is the narrow platform drill. Then we'll go and finish our tapered drills with a regular platform drill, which is 13mm long, so it's the yellow. Now we've decided it's dense bone, so we're going to use a dense bone drill and do that at 800 RPMs as well as all the others. Then we'll go to the screw tap, and we'll do that at actually a slower 45 Newton centimeter at 25 speed, and then we'll finish with the cortical drill. So we'll get out the 3.5 by 8mm tapered drill, and we'll use this first, and this is an internal irrigated drill. So here it is. You can see it's a fairly aggressive cutting drill, so it's going to generate heat. So we want to make sure that that has the coolant going on the outside and also on the inside of the drill. So we use that guide sleeve. You can see that that fits with this implant drill, and we'll put the cannula into the back of that actual drill, and then we'll drill to 8mm using the first protocol. So there we go. You can go in. You don't want to stop the drill mid-course though. You want to go in and out and continue the drilling protocol. So there's the first start of the osteotomy. It's in the exact position, and this is what we want. We don't want to be doing implants at the inappropriate depth. We want this to be 4 millimeters below the free gingival surface. So we're going to come to the next drill, which is also a tapered drill. It's a 3.5 by 13. So it's the actual length of the implant. And actually the drill is about 1.5 millimeters longer than the implant. So you do have to take that into consideration around nerve. So looking at this, we can see that the drill is going at 800 RPM. And we'll start and we'll go into the sleeve. Same sleeve, so there's only 2 sleeves on this. The drill guides are only 2. So we'll go in and we'll use lots of water, of course, with saline to irrigate this, and then we'll go in and out and make sure that the area is getting properly prepared. So it's going to generate some heat. You'll feel heat in the actual drill when you're doing the protocol today. So feel that so you understand how much heat is actually created by the friction. Now we're going to use a 4.3 by 13 millimeter tapered drill, which is shown here in the yellow ring. So we'll pull that out and then we'll put that, and we can test that to make sure it fits, because I want you to see how this works. So take it and put it in now, but you normally are going to trust this during the surgery. So we put the guide back on and we'll put the drill, which is an internal irrigated drill, and we're going to run this at 800 RPM. And so when we do this, we can see that we're going to take this to the depth of the ring, and this will allow you to be at the position for final implant placement. There we go. So this would normally have irrigation, of course. You can see how much bone would be generated in this. So you can save that bone. There's the osteotomy again. It's at the right dimension for a regular implant placement. So if it wasn't dense bone protocol, we would actually place the implant now. We will continue on with the dense bone protocol, and so we'll go to the dense bone drill next. And this drill is going to drill some of the cortical bone, just make it so that the implant can be seated. And if we look at our protocol, we can see it's well into the next phase. And we're going to take this drill, place it. It also needs lots of water, and so we put it back into the cannula. And when we turn this on, we're going to make sure that the dense bone drill is going at about 800 RPM. So this is the key. So we'll go to the osteotomy now, and we'll go through the guide and push this drill into where we've already gone. And so this will allow us to get the width of the osteotomy a little wider. And then we could use a screw tap. So you can use these at a less, we want to go to 45 RPM at 25 ideally. And so this, you'd use a regular platform screw tap, and it puts a threading into the osteotomy. So it's almost like you're making the screw go in and grab. And this is nice if you're trying to get some stability, to even bypass the dense bone drill and go right to this drill. And you can get screw tap to really hold your implant in position quite nicely. So we'll take this in and watch. It's going at a lot slower RPMs. So we have this, and as it goes in, you're going to go all the way down, and then you have to kick the outside button on your engine and reverse it out. So don't go in at 800 RPM. You'll get a little bit of a shock because it'll pull right in. And you could actually damage the osteotomy, which we don't want you to do. So then we reverse and take it off. And you could use the cortical bone drill as well, which will sometimes allow you to seat the final abutment. But I also use the CC bone mill, and that's one of my favorite. It's something that I designed, and then Nobel made it. But bone mills were around, but mine was to be flared. And so you can see here, we're going to take the cortical drill, and this is going to be at 800 RPM. And this is just going to prepare the surface for the implant to be placed. So the exciting part's coming. We're going to place the implant, and this is what we've all been waiting for. And we're going to all place it in the exact same position. So I don't know how many are here today, maybe 60
now
people.
You want to open the
and
implant
every one of us are going to have the implant in the exact same position.
But you're going to open the blister pack and then pinch it top to bottom, and that will allow the implant to drop into your sterile field. So then you'll actually have this plastic vial, which is sterile. And so the sterile team can then open that and then get into the canister, and the canister is going to allow you to deliver the implant. So once we get that, then we're going to want to attach the mount to the implant. So you'll hold the inner vial and then take the implant mount and connect it. And then you'll take a unigrip screwdriver and you'll attach it, and you can add this so that you're going to be able to place the implant. So you want to make sure that the guided implant mount is fully seated on the shoulder of the implant platform when you're placing this. There's a little ring in the connection to handpiece, and this is sometimes gone. There's a little rubber band. So you'll pick up the implant and with the connector, and then bring it and start to place the implant. If you look at this diagram, you can see the mount's been added, and it shows that it's 9 millimeters. And so this allows you to place the implant into the correct depth. So this mount is also how you carry the implant. And so you'll use the connection to implant, which is in the top part of the kit, and you come and pick it up. So here's the two implant mounts, and we're going to use one of these. And we don't have the vial. So you remember the vial looks like this, and so we're going to use just our hand to pretend we have the vial, but we just don't have that aspect here. So we will attach the mount to the actual implant, and these dummies are just little brass dummies, and so we'll add this. So there's the mount, and we're going to add this to the implant. So normally this would be in the vial. I know I said that, and then you put this on, and then you're going to screw in the screw and use the unigrip driver to tighten that down. Now that once the connection to implant is on your driver, so your motor, then you're going to come and pick up the mount utilizing this assembly. So it'll snap down over the hex on the mount, and then you lift the implant out of the little vial and then go to the guide and place the implant in the mouth. So this needs to be tightened, and of course we're handling this, but we don't want to handle this aspect of the system. So on the real implant, you're going to have a TiUltra surface, which is hydrophilic, and you don't want to be touching that. So you want to use the connection to implant to carry the implant. The implant needs to go in to 45 Newton centimeters, and this would be ideal for this implant system. So as we're putting it in, you can see that we have to put a little bit of pressure down because of the tapping, and then it takes a little bit more time to put it in because of the thread is small, so the pitch. So as we put this in, we can see that we've got it in the right spot. Everyone in the class is going to have this in the exact same spot. And that is the beauty of the guided implant systems. You get to the exact spot that you planned on the DTX. So if we copy it and make a whole bunch of different guides, we're going to get to the same position. That's what you want to have in guided surgery. And this is also important. You've got to make your plan. See how this is up a little bit? You got to make sure your plan is 4 millimeters from the surface vertical soft tissue, as we talked about in the course. So this is a zero bone loss concept, so we need to have some tissue.
So this has to be planned. We also have to remember that when you drill the osteotomy, it's going to be 1.5 millimeters deeper than what your implant is, and that's just the way the system works. So I could take this and take the torque wrench and torque it in a little bit more, but really you should take it out, drill a little bit deeper, because this is not in the exact position because we're dealing with a model. And so if it was planned exactly to an x-ray, you're going to get exactly where you want to go. You're going to miss roots, you're going to miss teeth, and you're going to miss sinuses and nerves, and you're going to have control, and that's what we want to do, is have control for long-term success. So we use also a CC bone mill if there's any bone in the way, and this is something that we can do to protect things. So this is what we want to have, is an implant driven in at the end of the day by an exact procedure.